When was the last time you truly noticed your feet? Not just glanced at them while putting on socks. I mean, really noticed them the way they carry you, balance you, and silently support you with every single step. For 74-year-old Carol, it was the moment she slipped in her kitchen. 1 second she was reaching for a tea mug. The next, she was on the floor, unable to stand, with a deep wound on her heel that had gone unnoticed for weeks. Carol wasn't reckless. She walked every morning. She lived alone, but carefully. The real problem started months earlier, a cracked callus that seemed harmless. She never felt pain, just a little dryness. But what Carol didn't know was that poor circulation had quietly dulled the nerves in her feet. She didn't feel the crack deepen, or the infection set in, until the swelling began to affect her balance. That one fall, it led to a 6-week hospital stay, a serious bacterial infection, and a slow, painful recovery that she described as losing her independence one limp at a time. If any of that feels close to home, please stay with me. Because the truth is, foot problems are not just a matter of discomfort or dry skin. They are one of the leading, yet most overlooked causes of falls, infections, and loss of mobility in seniors. And it doesn't have to be this way. In the next few minutes, you'll discover 4 powerful yet simple foot care practices that can protect you from dangerous infections, improve your balance and stability, and help you stay confident on your feet, no matter your age. And the last one? It's a mistake more than 90% of seniors make, and it could be putting your entire lower body at risk. So please, walk with me through this journey, gently, carefully. Type 1. In the comments if you or someone you love has struggled with foot pain, numbness, or a fear of falling. You're not alone. Because while your feet may be the furthest part from your heart, they're often the first to show signs that your health is shifting. Let's explore what they might be trying to tell you before it's too late. Number 1. The forgotten foundation. Why senior feet break down first. Imagine building a home. You pour love into the walls, paint the rooms in your favorite colors, furnish each space with care. But one day, the foundation begins to crack. Not loudly, not suddenly, just small shifts, creaks in the night, hairline fractures that widen over time. That's what happens to our feet as we age. They are the foundation of everything we do, from getting out of bed, to watering plants, to hugging a grandchild. Yet, for many older adults, the feet become the most neglected part of the body, covered in socks, hidden in shoes, and often left to just hurt a little, in silence. But here's the truth. Foot deterioration is not just about wear and tear. It's about circulation, nerve health, muscle loss, and a slow erosion of connection between the brain and the body. Let me explain. By the time we reach our 60s or 70s, several things start changing quietly beneath the surface. First, blood flow to the extremities, especially the feet, begins to decline. Arteries narrow, capillaries stiffen. That tingling or numbness you sometimes feel when you wake up, that's your body's way of whispering, "Hey, I'm struggling to reach down there." Then there's neuropathy, especially common in seniors with diabetes or circulatory problems. The nerves in the feet grow less responsive. You don't feel small injuries. A pebble in the shoe, a tiny blister, a cracked heel, they go unnoticed. And when injuries go unnoticed, they don't get treated. When they don't get treated, infections grow. And when infections grow in feet with poor blood flow, healing becomes almost impossible. This is how a simple toenail fungus becomes a foot ulcer. How a tiny callus becomes a doorway to bacteria. How one missed step leads to a broken hip. My patient Thomas, 72, used to walk daily at his local park. One spring he noticed his balance was off. He chalked it up to just getting older. But what he didn't realize was that his arch had collapsed slowly, silently changing the way his entire leg aligned. His knees started aching. Then his hips. 1 month later, he tripped over his own slipper, fractured his ankle, and hasn't walked without a cane since. The foot is a biomechanical miracle: 26 bones, 33 joints, over 100 muscles, tendons, and ligaments. It's not just one body part. It's a complex ecosystem. And when it breaks down, the entire structure above it begins to falter. Yet many seniors only notice their feet when something hurts. That's not a judgment, it's reality. Our society teaches us to care about heart health, brain health, maybe even gut health. But the foot? It's treated like an afterthought, a minor character in the story of health. But here's something most people don't know. Your feet are one of the first places to show signs of aging, related inflammation, nerve decline, and balance deterioration. So how do you know if your feet are already trying to warn you? Start by asking yourself, do your feet feel colder than the rest of your body even indoors? Are your toenails thickening, yellowing, or oddly shaped? Have you started walking differently, shuffling, slowing, or needing to watch your step more often? These are not just cosmetic issues. They are often biological alarm bells, signs that circulation is struggling, nerves are misfiring, or muscles are weakening. And it's not just physical. When seniors begin to fear falling, they walk less. When they walk less, muscles atrophy. When muscles atrophy, confidence fades. It becomes a feedback loop of shrinking movement and growing fear, one quiet step at a time. But here's the good news. Unlike worn-out knees or aging spines, feet respond quickly to attention. In the next section, we'll uncover a few simple but powerful rituals, things you can do in under 10 minutes a day to restore circulation, improve foot sensitivity, and keep your steps steady and strong. Because whether you're 67 or 87, your feet still want to carry you. They just need a little help to remember how. Let's give them that. Ready to take the first step? Let's move forward quite literally into what healing looks like. Number 2. Circulation and sensation. The silent saboteurs beneath your ankles. Think of your feet as the river's delta, the very edge of your body's vast internal landscape. The heart pumps like a distant mountain spring, but by the time the blood reaches your toes, the journey has been long, winding, and full of obstacles. And like any delta, if the flow becomes weak, stagnant, or blocked, decay begins. In the aging body, poor circulation and diminished sensation are like slow rust, quiet, subtle, but steadily destructive. You don't wake up one morning and suddenly lose sensation in your toes. It happens slowly. A skipped signal here, a dull ache there, until one day, you realize you can't feel the floor under your foot. Let me walk you through why this happens and what it means. As we age, our blood vessels become less elastic. Think of them like garden hoses left out in the sun too long. They harden, stiffen, and can no longer expand to accommodate the flow. This is called peripheral vascular resistance, and when it builds, less oxygen-rich blood reaches the extremities, your hands. Yes, but especially your feet. Without that blood, tissues become starved. Skin dries and cracks. muscles fatigue faster, and most dangerously, wounds struggle to heal. Now add to this the issue of neuropathy, the gradual dying back of nerve endings, especially in the toes and soles. It's often compared to unplugging a lamp from the wall, except you don't even realize it's off until you're stumbling in the dark. One of my former patients, Dennis, 68, used to be a carpenter. He'd spent decades on ladders and rooftops, boots worn thin with effort. When he came to me, he said something that still echoes in my mind. I didn't realize I was losing my feet until I stepped on a nail and didn't feel a thing. That nail puncture, invisible and painless, led to an infection that spread through the soft tissues of his foot. Because circulation was poor and sensation gone, he didn't seek treatment right away. By the time he did, he was facing partial amputation. This isn't rare. Each year, tens of thousands of older Americans are hospitalized due to foot infections that could have been prevented, or at least detected earlier, if sensation had been intact. So, what are the signs of poor circulation and neuropathy in your feet? They're not always dramatic. Sometimes it's a persistent coldness, even when the rest of your body is warm. A burning sensation at night that wakes you from sleep. Numbness or pins and needles that lingers longer than it should. Skin that appears shiny, thin, or bruises easily. Toenails that become thick, brittle, or change color. Your feet may also look different when raised versus lowered. If they pale when elevated and turn reddish-purple when you dangle them off the bed, that's a classic sign of arterial insufficiency. But here's something hopeful. Your feet, though vulnerable, are also deeply responsive to care. Even small shifts in daily routine can begin to reverse some of these changes. For example, simple foot soaks in warm, not hot, water with Epsom salts can help stimulate local circulation. Or gently massaging the soles and ankles with a tennis ball can reactivate nerve pathways that have grown sluggish from disuse. Walking even slowly, even just around the house, is medicine for the feet. When you walk, you're not just exercising muscles. You're squeezing blood vessels like pumps, encouraging flow. You're giving the brain a chance to rebuild its map of where your feet are in space, something called proprioception. I've seen patients who hadn't felt confident barefoot in years begin to regain sensation after just 6 weeks of simple footwork and circulation rituals. No fancy equipment, no gym, just daily care, deliberate touch, and consistency. And if walking is difficult, seated exercises can work too. Flexing the ankles, rotating the toes, wiggling each digit slowly with your hands. These all send messages through the nervous system. This part of me matters. Don't forget it. Foot sensation is not just about feeling textures underfoot. It's about safety, autonomy, and confidence. When you can't feel your feet, you hesitate. You stop trusting the ground. And life starts shrinking to what feels safe. One room, one hallway, one limited life. But you were not made to be confined by fear of falling or numbness underfoot. What's waiting for you on the other side of circulation and sensation recovery? Perhaps it's as simple as walking across the grass barefoot again without flinching, or standing in the kitchen, cooking for someone you love, without needing to hold onto the counter. We'll talk next about one of the easiest and most overlooked strategies for strengthening this connection between your brain and your feet. One that requires no equipment at all, just intention. Because healing your feet starts not with your soles, but with your attention. Let's keep going. Number 3. The daily ritual that awakens aging feet. There's a quiet intelligence in your feet, one that remembers how to walk before your mind does. Think about it. You didn't learn to walk by thinking. You learned by doing, by falling, wobbling, rising again. Your feet learned the rhythm of movement long before your first words. But with age, that rhythm fades. Not because the body forgets, but because we stop listening. One of the most powerful ways to reawaken that connection is a practice I call foot mapping, a simple 5-minute ritual that brings awareness, blood flow, and strength back to your soles, with nothing more than your hands and your breath. Let me walk you through it and explain why it matters so much more than it may seem. Most of us, especially in our later years, treat our feet like distant relatives. We acknowledge them only when they ache or fail. But what if instead you started each morning by greeting them? Start by sitting in a quiet place before the day rushes in. Take off your socks. Let your feet breathe. Place one ankle over the opposite knee and simply look. What do you notice? Color? Swelling? Dryness? Tender spots? Touch the top of your foot, then the arch, then the heel. Use your fingers to trace along the toes, the ball, the sides. You are not just checking for damage. You are reintroducing your brain to this part of your body. Science calls it somatosensory stimulation, a fancy way of saying, remind the mind what's below. Because here's something remarkable. Your feet are loaded with over 7,000 nerve endings. They feed signals to your spine, your posture, even your mood. And when those signals fade, whether from neuropathy, neglect, or disuse, your body loses its map of balance. That's why foot mapping isn't just spiritual or symbolic. It's neurological. It's circulatory. It's restorative. As you massage your feet, use small circular motions. Spend time on the heel. This is often where fascia tightens, reducing flexibility. Gently pull each toe, one at a time. Not to stretch, but to wake. My patient Shirley, 76, used to start every day limping to her kettle. She'd given up walking her garden because the gravel hurt her feet too much. She called them untrustworthy. We began this 5-minute ritual together. Seated, silent, foot in hand. Within weeks, her gait changed. Her confidence grew. And one day, she told me with a grin, I danced in the kitchen this morning. No music, just my toes. What changed wasn't her age. It was her awareness. Now, if you want to deepen the ritual, here's how. Before the massage, soak your feet in warm water with rosemary or ginger herbs known to boost circulation and reduce inflammation. This turns your 5 minutes into a full sensory reset. The warmth draws blood to the surface, and the scent reminds your nervous system it is safe, grounded, and present. After the massage, practice foot articulation. Roll your ankles slowly in each direction. Flex and point your toes. Rock forward and back from heel to toe, even if seated. Each of these movements recalibrates your proprioception, your body's ability to sense where it is in space. And proprioception, more than strength or even eyesight, is one of the top predictors of balance. Now, I want to be clear, this is not about performing a routine for the sake of doing something healthy. It's about restoring a relationship between you and the very parts of your body that hold you up. Some days, you'll feel silly. Some mornings, your feet may resist, stiff, swollen, disinterested. But keep going, because each day you return to this practice, you're sending a message. You still matter. I haven't forgotten you. Over time, this daily ritual builds more than circulation or sensation. It builds trust. And with trust comes movement. With movement comes freedom. And with freedom comes the return of something many seniors fear they've lost: autonomy. And off. All. 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 So tomorrow morning, don't start your day with the news or your to-do list. Start with your feet. Take 5 minutes. Say hello. And remember, the path to feeling steady, safe, and strong again doesn't begin with a fancy brace or expensive shoes. It begins right where it always has, at the ground beneath your feet. In the next section, we'll explore a surprising and often ignored threat to your foot health that may be sitting inside your bathroom right now, one that can turn a minor issue into a major medical emergency if you're not careful. Let's turn the corner and shine a light on the hidden dangers lurking in plain sight. Number 4. The bathroom trap. Hidden hazards that destroy senior feet. If there's one place in the home that seems the safest, clean, controlled, familiar, it's the bathroom. But for aging feet, that tiled sanctuary can become a silent battlefield. Slippery floors, damp mats, and the hidden habits we never question, these are not just minor risks. They are, for seniors, often the perfect storm for infection, injury, and long-term mobility loss. Let me explain. The most dangerous mistake I see older adults make with their feet doesn't happen outdoors or at the doctor's office. It happens after a shower. Every day, thousands of seniors bathe, dry off, get dressed, but never properly dry or inspect their feet. And in those tiny, moist spaces between the toes, warm, dark, and often forgotten fungal infections thrive. Now you might be thinking, come on, it's just athlete's foot. But here's the truth. For seniors with reduced immunity, diabetes, or poor circulation, a minor fungal infection can spiral into cellulitis, ulcers, or worse, even lead to hospitalization. Moisture, left unchecked, weakens the skin's barrier. Cracks form. Bacteria move in. And if sensation is already reduced, you might not notice until redness and swelling signal something far more serious. One of my former patients, Barbara, 73, was meticulous about hygiene. She showered daily, used gentle soaps, even bought lavender foot creams. But she never dried between her toes, not because she didn't care, but because no one ever told her to. She arrived at my clinic with what she thought was a bug bite on her pinky toe. By the time we ran labs, she had a deep tissue infection that required IV antibiotics. All from a tiny fissure hidden between 2 toes. The culprit? Moisture, warm socks, and time. But it's not just water that harms. The bathroom is also where many seniors clip toenails, often bending in awkward positions, using dull or inappropriate tools, cutting too short or at angles that invite ingrown nails. Ingrown toenails may sound benign, but for someone with compromised healing, they can become an open door to infection and inflammation. And when walking becomes painful, movement stops. When movement stops, circulation suffers, and the downward spiral begins. So what should you do? Start by rethinking your bathroom routine as a medical ritual, not just a hygiene task. Here's how. After every bath or shower, sit somewhere safe and stable. Use a clean, dry towel to pat not just the tops of your feet, but between each toe thoroughly, but gently. Don't rush. These seconds matter. Then, inspect. Not with fear, but with presence. Look for redness between toes, peeling skin, especially around the arch, soft white patches, a sign of moisture-related breakdown, tiny cracks or fissures in the heel, swelling around the toenail beds. Next, Apply a light, non-greasy moisturizer, but only on the soles and tops of the feet. Avoid applying lotion between the toes. It traps moisture and can worsen fungal growth. For toenail care, use proper tools. A straight-edge nail clipper, not curved. Disinfected between uses. Clip nails straight across, never rounded, and don't cut too short. And if bending is difficult or eyesight is poor, please consider a podiatrist or a trained foot care nurse. Many offer home visits or community clinic hours, and the peace of mind they provide can spare you months of recovery down the road. Now, let's talk briefly about bathroom design, because environment matters too. A slippery tile floor, a folded-up bath mat, or a low toilet seat can turn a minor misstep into a disaster. If you live alone or fear losing your balance, use non-slip mats with strong grip. Install grab bars, even if you feel steady today. Keep a chair nearby where you can sit safely to dry your feet or apply lotion. Never rush. Allow your body to transition from warmth to standing gradually. I've seen it time and time again. A fall that breaks the hip didn't start with a clumsy step. It started with a wet floor and unsteady feet. Your bathroom is not a threat, but it needs your attention. And your feet? They need protection, especially in places where accidents love to hide. We often associate health with doctors and hospitals, but healing happens at home, in your bathroom, in your habits, in your choices. Protecting your feet doesn't require expensive products or fancy equipment. It takes mindfulness, consistency, and the willingness to see daily routines not as chores, but as acts of care. The smallest cracks often let in the biggest problems. But with attention, those cracks can be sealed and safety restored. In our final part, we'll bring everything together and reflect on what your feet truly represent, not just as body parts, but as symbols of your freedom, strength, and ability to keep moving forward in life. Don't miss it. This next piece is where the heart of the journey lives. There's something humbling about the feet. They're not the part of ourselves we show off. They don't get thanked for the miles they've walked, the burdens they've carried, or the quiet stability they've offered through all of life's seasons. And yet, for most of us, it's the feet that meet the floor first in the morning, and the ones that ache quietly as we drift to sleep. If you've made it here, perhaps some part of you is beginning to realize your feet aren't just appendages. They are your anchors, your compass, your connection to the world, step by step, breath by breath. We often fear losing our memory, our strength, our sight. But very few talk about what it means to lose our footing literally, to hesitate before rising, to question every step, to stay home, not out of laziness, but because the floor no longer feels safe. But what if it doesn't have to be that way? What if tending to your feet, drying them, moving them, noticing them became your quiet form of devotion? Not because you're falling apart, but because you finally understand that your foundation is worth protecting. Your feet have not failed you. They've just been waiting for your attention, waiting for the moment you choose to partner with them, not push past them. And that moment, that choice can begin today. Maybe it's taking a little more time in the shower. Maybe it's setting aside 5 minutes to massage your soles in the morning sun. Or maybe it's simply standing barefoot, feeling the earth beneath you and saying, I'm still here. I can still move forward. Because every journey, whether across the living room or out into the world, begins the same way, with a single step. If this message stirred something in you, I invite you to keep walking this path with me. There's more to explore, more to understand, and more to protect, especially the parts of ourselves we've too long overlooked. And always, please remember, this video is meant to inform and inspire, not replace medical advice. If you're experiencing foot pain, numbness, or wounds that don't heal, speak to your healthcare provider. You deserve expert care, and you deserve to feel safe in your body. But in the quiet hours of the day, when it's just you and the floor beneath you, may you find a new kind of trust in each step, and a renewed belief that movement, no matter how small, still belongs to you. Your story isn't slowing, it's steadying. And sometimes, steady is exactly what strength looks like.